Hello, here we're going to take a look in this module at core drug knowledge and lifespan concerns. This module is broken down into 6 sections, each covering concepts related to medications and lifespan and patient concerns. To begin with the basics, pharmacology is the study of drugs and their effects. Pharmacotherapy is the use of drugs to prevent, diagnose, or treat disease processes. These could include vaccines, prophylactic antibiotics, HIV medications to prevent AIDS, PPD or IVP dye to diagnose, beta blockers, or antibiotics to treat conditions or diseases. When we talk about systemic drug effects, we either want to stimulate an action or prevent an action from occurring. Many drugs we talk about will be classified as agonist or antagonist. An agonist binds to receptors to produce a response. An antagonist blocks an action of an agonist and causes an action opposite of the agonist. It is important to nursing and pharmacology because understanding these terms is going to give us a better understanding of the expected mechanism of action and how these medications work in order to treat a disease process. Please view the short video here looking at agonists and antagonists. Pharmacokinetics is the study of drug absorption, distribution, metabolism, and excretion. We will frequently be referring to the ADME of medications. Pharmacokinetics also looks at how a drug gets to its receptor in the body. This is broken down into absorption and distribution. The study of how a drug is changed and excreted by body processes revolves around distribution and excretion. With absorption, you have absorbing into the body fluids. With distribution, we have going to the sites of action. With metabolism, we have medications or drugs being metabolized into inactive or active metabolites. And excretion is removal of those metabolites from the body by various routes. So pharmacokinetics is the effect the body has on the drugs. And then we have pharmacodynamics, which is the effect that drugs have on the body. Like we mentioned before, pharmacokinetics includes the absorption, distribution, metabolism, and excretion of the drugs, whereas pharmacodynamics refers to the relationship between drug concentration at the site of action and the resulting effect, including the time course and intensity of the therapeutic or adverse effects of that medication. The effect of a drug present at the site of action is ultimately determined by that drug's binding with a receptor. Essentially, receptors are protein molecules that receive signals, which in turn create a cellular or tissue response. Receptors may be present on neurons in the central nervous system to depress pain cessation, on cardiac muscles to affect the intensity of contraction, or even within bacteria to disrupt the maintenance of the bacterial cell wall. For most drugs, the concentration at the site of the receptor determines the intensity of a drug's effect. However, there are other factors that affect drug response. Density of receptors on the cell surface, the mechanism by which a signal is transmitted into the cell by second messengers, which are substances within the cell, or regulatory factors that control gene translation and protein production. All of these may influence drugs' effects. These factors also play a role in regulation, whereas regulation results in variation of sensitivity to drug effects from one individual to another. This also determines enhancement of or tolerance to drug effects. We need to consider both pharmacokinetics and pharmacodynamics to assess the effect that a drug regimen is likely to have. Both of these are important in determining a drug's effect. The selectivity and specificity of drugs and their binding to certain receptors has an effect on the actions of the drug. Specificity is the ability of the drug to produce an action at a specific site. This also has to do with potency, efficacy, and affinity. Potency is the relative amount of a drug that has to be present in order to produce the desired effect. Efficacy is the ability of a drug to produce an effect at a receptor. Affinity is the extent to which a drug binds to a receptor. The greater the binding, the greater the action. So if a drug only binds to one receptor, it will be very specific in its effects. If it binds to multiple receptors, the effects will vary depending on the location of those receptors. So looking at the information here on this slide, what does this tell us about medications? Specifically, beta blockers in this scenario. Think about the potential side effects, adverse effects, or comorbidities that could affect this. Here we have beta blockers that bind to both beta-1 and beta-2 receptors. These medications can cause bronchial constriction at the beta-2 receptors in the lungs, and they also affect the heart rate at the beta-1 receptors in the heart. So, if a beta blocker binds to both beta-1 and beta-2, it's going to have an effect on the lungs as well as the heart. So looking at this, it may be a good antihypertensive agent, but it can also cause bronchial constriction at those beta-2 receptors. So this could be problematic, especially for patients with COPD and asthma. One of the most important components of pharmacology is determining dosages. Have you ever considered how your healthcare provider knows how much a medication to prescribe? Who creates the dosing guidelines? Where do they come from? The concept of the dose-response curve helps us to determine the relationship between an effect of a drug and the amount of drug given. Dose-response curves are essential to understand the drug's safe and hazardous levels so that the therapeutic index can be determined and dosing guidelines can be created. We need this to prevent toxic effects and hazards of overdose. Here we have the dose-response curve. The dose-response curves are charted on a simple XY axis, with the drug's dosage typically on the x-axis and the response to the medication typically on the y-axis. When evaluating a dose-response curve, one of the main characteristics of the curve is that it is a graded relationship. This means that the amount of drug given is increased, so the response to the drug is also increased. The grading of the dose-response curve shows how we can tailor the medications to the individual taking the drug. Here, the first curve illustrates the dose, which should provide a therapeutic effect, and the second curve illustrates the dose that could provide an adverse effect. The area in between the margin of safety, here we get the primary effects without the secondary effects. The dose response involves principles of pharmacokinetics and pharmacodynamics. It determines the required dose and frequency as well as that therapeutic index in between. But remember, this is also going to vary by population. It's going to vary by patient-related factors, such as pregnancy, comorbidities, or other medications that the patient may be taking. We should also take a look at two additional terms here, potency and efficacy. Potency is the amount of drug that is required to produce an effect. Efficacy is the maximum response achievable of a drug, no matter the dosage. In this chart, the x-axis is the dose and the y-axis is the effect. Efficacy is the maximum response achievable no matter how much the medication has been provided. And potency is the amount of the drug that is required to produce the effect. Just remember that. These graphs show us the difference between both. So when we look at the efficacy component here, regardless of the dose, which is the same here for these two drugs, Demerol and Tauin, the drug that will max out on its effects more quickly, which one is that? Most importantly here, which one is more effective at the lower dose? Demerol. In regards to potency, the amount of the drug needed to be effective, which is more effective here at a lower dose when we look at meperidine and morphine? At a lower dose, morphine is more or just as effective as meperidine. More meperidine, also known as Demerol, is needed in order to get the same effect as morphine. So what determines this potency and efficacy? This mostly has to do with the ability of binding to those receptors like we talked about before. A response at a low dose is caused when more of the drug binds quickly to those receptors. If the drug is less potent, this will not happen as quickly, and it will take those higher doses to achieve the same effects. Desensitization or downregulation refers to the common situation where the biological response to a drug diminishes when it is given continuously or repeatedly. It may be possible to restore the response by increasing the dose or concentration of the drug, but in some cases, the tissues may become completely refractory to its effect. The term tachyphylaxis is used to describe desensitization that occurs very rapidly, sometimes with that initial dose. The term tolerance is conventionally used to describe a more gradual loss of response to a drug that occurs over days or weeks. This is slightly more permanent. Where desensitization to a drug arises because of established chemical, hormonal, and physiological changes that offset the actions of the drug, discontinuation may mean that these changes themselves cause rebound or withdrawal effects. This is especially true with nitrates, opioids, and benzodiazepines. Please view the video here in this slide to further explain how downregulation and tolerance are important to consider when administering certain types of medications. Likewise, if the cell receives a weak signal or is exposed to an antagonist for a prolonged period of time, more receptors are created to increase the sensitivity to the weak message. This leads to an increase in the number of receptors. This is called upregulation. Upregulation results in supersensitized cells, especially after repeated exposure to an antagonist drug or prolonged absence of that drug. This creates great problems with opioid users. The exaggerated effects created by these endogenous receptors can be detrimental depending on the situation. Basically, here you have an increase in the number of receptors on the surface of target cells, making them more sensitive to a hormone or agent or other medication or drug.